One concern that you might have after surgery is, what do I do with my incisions? And since we'll be doing your surgery most likely laparoscopically, you may have as many as 5 or 6 small incisions. When you come out of surgery, those incisions will be covered with a small bandage, maybe even a Band-Aid or a small gauze bandage. We usually like to leave that on for approximately 24 hours. And so those usually come off the following day. We often place little strips called stereo strips over the incisions that are intended just to help give the incision some support while it is healing, although we always put dissolvable sutures underneath that. So if the strips come off with the bandage, it's not really a problem. But the main thing we would be concerned about if there was a problem would be if there was redness or if there was drainage from the incision. Obviously, if that occurs after you've gone home from the hospital, then you need to give us a call. Let us know that you may have some signs of infection so that we can get you in and take a look at that. Basically, you can start to shower about 24 hours after surgery, and just allow everything. You can just use a towel to kind of pat it dry. If the stereo strips are still on, then allow those to air dry. Usually once you're about a week out from the surgery, if the stereo strips are still on the incisions, you could go ahead and remove those. There are a number of things that could occur after surgery that obviously we want to know about and you may be concerned about. If you run a temperature or a fever, certainly if you have a temperature that's 100.5 or 101 or greater, we would like to know about that. It could be a number of causes for it, but obviously it could be infection. So if you have a temperature at any point that's 101 or greater, then I would recommend that you contact our office and let us know so we can figure out what we need to do to evaluate. Our first concerns about someone having nausea and vomiting is going to be, is this dietary related? Again, are they eating too fast? Are they eating too much? Are they drinking too much or drinking along with their food and that's overfilling their pouch? Is it possible they're not chewing their food well enough, or they just have chosen a food that's too tough or too coarse for that period after surgery? So one of the things they may have to also do is back up into an earlier stage in their dietary evolution, so that if they're at stage 3 diet, they may need to back up to stage 2. In other words, going back to full liquids and things that are much softer, and then advance a little slower than they were. But finally, one of the things we want to make sure of is that they're not having an actual problem or complication from the surgery, such as a stricture or an ulcer or something along those lines. So once we've gone through the dietary issues of slowing down eating, chewing your food well, and make sure we go through the progression slowly, then we need to know if that's not working. One of the problems that you could face after surgery is constipation. There are a number of factors that can contribute to that. One would be pain medication that might tend to slow the function of your colon. Others would be lack of hydration. Others would be a decrease in fiber intake. So what we want you to do is to concentrate on your fluid intake. Make sure that your activity levels are adequate. We obviously want to get you off of pain medications as soon as possible. And if you're having a real problem with constipation, we certainly would not want you to go more than, say, 3 days without being able to have a bowel movement. And so you would want to contact us and let us know if that is a problem, so that we could talk about the use of laxatives or other methods that might be helpful. And but primarily your main things to avoid that are going to be making sure you get fiber, and if you can't get enough fiber in your diet, you may need to use a fiber supplement. Make sure you're staying well hydrated, and make sure that you're staying active and walking and doing all the things that are going to help promote your normal bowel function. Another issue that you may face after surgery would be some hair thinning or hair loss. One of the things about the weight loss after a surgical intervention is usually pretty rapid, and I think that the body, reacts to rapid weight loss in ways that we don't fully understand. But certainly, your body is going to conserve certain nutrients for more essential body functions. And making hair and preserving hair may not be an essential body function. So, anyone who loses weight rapidly or a large amount of weight over several months period of time is going to face a certain amount of hair breakage. It's primarily an issue of the health of the hair and the strength of the hair. It's not generally that the hair is falling out or that the hair follicles aren't producing the hair anymore. It's more a function of hair breakage. So sometimes you may notice that as you brush your hair or you're using grooming methods that could increase hair breakage. As you wash your hair, you may notice that there's some hair breakage and you see hair, say in the bath or the shower. But basically, once things stabilize in your body, once the weight loss levels off, and then usually that's a point at which you seem to see that process reverse. And so it's generally a temporary thing that is going to subside at some point. Things that you can do to help prevent hair breakage and hair thinning would be to make sure you're taking your vitamins as recommended, to make sure that you're getting plenty of protein in. And if it becomes a real issue, then you may want to actually take some supplements, and we can recommend those, something for that would be more specific to the nutrition of the hair, things like biotin and zinc, and there are some preparations that are made for the health of hair and nails.
When you are ready to continue, use the menu on the left to select the next module.